Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. Do your joints hurt? Do you have arthritis? What kind of arthritis do you have? We've got a rheumatologist to help us with that tonight. Colon cancer is more frequent in young people, and is colonoscopy still the best way to make the diagnosis or prevent? Also, we're going to look back on 40 years, Family Practice Associates' year, to tell us about how medicine has changed during that time. And to start us off, my first guest is Dr. Haider Abbas, who is a rheumatologist for the Lexington Clinic. Welcome.
Thank you so much, Dr. Fox.
Well, let's start with rheumatologists. A lot of people don't recognize that. What is that? What does it mean? What do you do?
Thank you so much for asking me this question. I think it's something that a lot of people don't know. A rheumatologist is an internal medicine doctor who specializes in taking care of inflammatory diseases. These inflammatory diseases can be in the joints in the form of arthritis. They can be in the muscles in the form of muscle disease, or it can be sometime in the internal organs, for example, inflammatory lung disease or inflammatory eye disease. So basically we deal with all inflammatory conditions in the body.
Now you talk about inflammation, and I started the tease out at the beginning with inflammation of the joints and arthritis. There's different types of arthritis.
Absolutely, yeah.
Tell me about those.
So there are almost, if I tell you, you'll be surprised that there are almost 100 different types of arthritis.
Oh, wow.
And we divide arthritis into two big categories, and then there are subcategories under those arthritis. So the most common arthritis that we talk about and that we see in our practice are inflammatory arthritis. For example, rheumatoid arthritis, psoriatic arthritis, arthritis that we see with inflammatory bowel disease like Crohn's ulcerative colitis, arthritis that we see with gout, or arthritis that we see with connective tissue diseases such as systemic lupus, scleroderma, or mixed connective tissue diseases. So these are some of the examples.
Is there more common type than others? You hear a lot about rheumatoid.
Yes. I would say the most common inflammatory arthritis that come across our practice is rheumatoid arthritis. And rheumatoid arthritis is about, the prevalence is about 1%. It's seen in both male and females, slightly predisposition to female than male, like 3 to 1. And it is something that we can see as young as 2 years of age and as old as 90 years of age.
So how do you make the diagnosis?
So the diagnosis of rheumatoid arthritis in particular, it's a mixture of clinical features that you see in a patient, and there's certain diagnostic studies that you do. Patients typically presents with inflammatory joints, and it's very symmetric, like right hand, right wrist, left wrist, a lot of fatigue, a lot of stiffness, just run down feel. And then you do some lab testing, you look at inflammatory markers, then there are some specific tests for rheumatoid arthritis. These are called antibodies. So we look for those antibody tests in the blood. Interestingly, about 75 to 80% of the patients will have those antibodies, but about 15 to 20% might not have those antibodies. So we split the rheumatoid arthritis into seropositive, those with positive test, and seronegative with a negative test.
Okay, so let's say you make the diagnosis, somebody has rheumatoid arthritis, so there are certain treatments that you use?
Oh, absolutely, yeah. So when you look into the treatments, I always divide treatments into two main types. One that I want my patients to do, which are called lifestyle modifications, eat healthy, stop smoking, lose weight, exercise, and then there are pharmacologic treatments. Now the pharmacologic treatments have evolved over the last 20-25 years, and we can certainly spend an hour talking about those treatments. Briefly speaking, there are some traditional treatments which we call conventional disease-modifying anti-rheumatic drugs, and then there are some newer treatments which are called biologic disease-modifying anti-rheumatic drugs.
But the bottom line is, if you've got the disease, it is treatable and you can make it better.
Absolutely. It's pivotal to get to the doctor early, diagnose early, because this is a deforming, crippling disease. If you can see them early on, you can put them on the right treatment, you can make a huge impact in the quality of the life and also change them from becoming disabled completely to very functional throughout their life.
So if somebody thinks they have rheumatoid, whether it be the patient or the referring doctor, the sooner the better.
Sooner the better. We call it window of opportunity, the first 2 years. That's where the whole emphasis is. If you get them in the first 2 years, put them on the right treatment, you can absolutely make a perfect impact in their life, and they can live a normal life.
Well, thanks for coming in. Thanks for telling us about it. And thanks for all the care you give the patients.
Absolutely. Pleasure to be with you. Thank you so much.
We'll be right back.